respond in a formal way to your questions. Today is obviously Monday, and we're holding it today as the first one. We'll be holding them in subsequent weeks on Tuesday afternoon. We'll work out the time that is best and most convenient for everybody. So that's what we're starting to do. We're honored to be here on the territories of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nations. We're honored to be here on their lands today. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you very much and good afternoon. I want to start today by thanking the millions of people throughout the province who are doing what they need to do to get us through this pandemic. I know it has been a most challenging time, and we had lots of optimism, and we are now in a place where we need to take additional measures. And I know most people in this province are doing their part. And I also want to thank our healthcare workers across the spectrum in the province that go to work every single day to do the best they can to care for us as a population and individual patients, whether that's in an acute care facility, in our ICUs, the healthcare workers that are greeting you at the door, our paramedics, our public health teams that I talk to every single day. My colleagues across the province are stepping up even after 20 months of this, and even when they're tired, to make sure that we're doing the best we can to care for people across the province. You have faced and continue to face an incredible amount of pressure and stress, and I am incredibly grateful. And I want everybody to know that your efforts are gratefully felt by the vast majority of us here in BC. We stand with you and are supporting you in everything that we can do. Today is a couple of things today. One is our BC vaccine card comes into effect today. This means that we'll be able to do more of the things that we love, that much more safely, knowing everybody else in that situation is vaccinated as well. My hope is that in the weeks ahead, we'll be able to remove things like capacity limits and other restrictions because of the protection that we have, knowing that vaccinated people are in these settings. I'm pleased to see that over 1 million people across the province now have downloaded their card or have it coming to them in the mail. Thank you for your continued commitment to doing your part to keeping our province safe and to keeping those important functions open, those jobs going. If you have not yet taken the steps to get your vaccine card, it only takes a few minutes. And for these next couple of days, as everyone gets used to the system, please be patient. We're in this together, and we'll get through this. We'll get over the bumps over the next little while. To those of you who have not yet been vaccinated, clinics are open every day. And if you have concerns, connect with your doctor, talk to your pharmacist, get the information that you need to make the right choice to protect yourself and your community. I'm also happy to say that the vaccine card now means that the orders that were in place in interior health, restrictions on gatherings, restrictions on some operations of some businesses, will now be revised to allow for exemptions to the restrictions for these businesses and events that use the BC vaccine card to ensure attendees are fully vaccinated. That extra layer of protection means that we can now start going back to those activities in the interior health that had been restricted over the last little while as cases increased. Also today, in addition to the vaccine cards coming into effect, we're making 2 additional changes in our pandemic response. Late last week, many people would know, the National Advisory Committee on Immunization announced their recommendations for a 3rd dose for a group of people who are severely immune compromised. And in alignment with these recommendations, we will now be providing a 3rd dose to that group of people. For the vast majority of people, a 3rd dose is what we would call a booster shot. It means it would increase our response and prolong our response. But for people who are immune compromised, it's a different story. As a result of their medical conditions, people who are immune compromised don't respond as well to any vaccine and have a reduced ability to fight infection. This means that they may not have responded adequately to the first 2 doses. and given them sufficient antibodies that they would be protected. And this puts them at much higher risk than most of us. For these people, a third dose is needed to give enough protection that most of us would get after our primary series of 2 doses. So for these people that have less protection from 2 doses than the rest of the population, the third dose completes that primary series. Here in BC, we have identified and prioritized a group of about 300,000 people who have medical conditions that make them clinically extremely vulnerable to COVID-19, our CEV group. And these are the people that we prioritized early on, along with other high-risk people by age, to receive their vaccine series. Part of this group, a subset of this group, are people who are severely immune compromised. This is about 15,000 people, and these are the people who will be receiving an invitation this week to receive a third dose starting today to complete their primary series. And the group of people we're talking about are people who've had solid organ transplants, people who are being actively treated for hematologic cancers and lymphoma, people who've taken anti-CD20 medications or B-cell depleting agents. These are medications that cause suppression of an immune system since January of 2020. People with severe primary immunodeficiencies. So these are some conditions that people are born with that means that their immune system doesn't respond as well, particularly the cell-mediated immunity like your T cells and your B cells. And people who've had a bone marrow or stem cell transplant. So this group of people, you will be receiving a text or an email from IMSBC. We know who you are because you've received your CEV cards and you've received your vaccine doses. And you'll be receiving a notice this week to be able to go in to any clinic in BC and get your third dose. The studies that show that many people in this group get no or very few antibodies even after 2 doses of vaccine, and a third dose can stimulate a moderate response in as many as half. What does this mean? This means that even though you have 3 doses of vaccine, it is still important for people who have severe immune compromising conditions to continue to take precautions to avoid exposure. And it reminds us, again, that there are some people who cannot get as much protection from these vaccines, and it's that much more important that all of us around them are protected to keep them safe as well. As part of our clinical extremely vulnerable group, there are also a second group of people, about 120,000 people in BC, who are moderately immunocompromised, who are also identified by NACI as people who might need a third dose as well to complete their primary series. Here in BC, we are looking at these data, and we'll be our BC Immunization Committee will be reviewing this with the clinical experts that have developed the CEV program, and we'll be providing an update for those individuals once we have a better understanding of these risks, and that's likely to be later in September or early October. If you do not receive an invitation, you do not need a third dose at this time. It really is limited right now to those about 15,000 people that we know are severely immunocompromised. But rest assured, we are looking at that information and we'll be getting in touch with people soon. The third group of people in our CEV group is the majority, and those are people who have a strong immune response. We know that they have a condition that made them more susceptible to having severe illness from COVID-19, but that their immune systems respond as well as everybody else's to the 2 doses of vaccine. If you haven't had your second dose, now is the time to do that, and we will be monitoring the vaccine effectiveness as we are for everybody over the next few months. And if a third dose is required, a true booster dose, then we will be prioritizing everybody in the clinically extremely vulnerable group again to make sure that you get your third dose soon. The third thing that we're talking about today, as we've done with people who work in long-term care, we're also making changes to the vaccine requirements for all healthcare workers who work in acute and community care across the province. We'll be implementing a new order that makes vaccination against COVID-19 a condition of employment across all healthcare facilities in British Columbia. This includes all workers, students, physicians, residents, contractors, and volunteers who work in a healthcare facility, including contracted facilities, which are accessible to patients and where they receive services. So it also includes people who work in settings such as home and community care locations, including clients' homes. This order will come into effect on October 26. I recognize that there are some rare instances where people may have a medical condition that prevents them from being fully vaccinated, and we will have a process in place through my office with a committee of experts provincially to review every individual request for a medical or religious exemption. And the details of that will be coming out very soon. I recognize that for some people the vaccine card is difficult or something that they have challenges with. And I'm very disheartened to see, however, that some people find that it's okay to take out this frustration on healthcare workers. Our healthcare workers across BC are day in and day out providing the care we need in sometimes extremely stressful situations. And they continue to care for people no matter what their vaccination status is, whether you have COVID-19 or whether you have any other illness in this province. But I know from talking to my friends and colleagues, we are tired and stretched from this pandemic, and we are all working tirelessly regardless of that. We must all come together to show our respect and caring for the healthcare workers who have supported us over this last year and a half. That means being patient. It means being respectful when you are asked to wait before entering a healthcare facility or asked to come at a specific time. It's making sure you continue to wear a mask in all healthcare settings. That is still the rule. That is still required in all healthcare settings across this province because we know that those are higher risk settings and it's a setting where people are more vulnerable to getting COVID-19. These rules are in place to protect all of us, patients and healthcare workers alike, and we need to respect them. Our hospitals are strained right now, and they're strained with the added burden is being felt across the province. Our emergency departments, our ICUs are filling up, not just with patients who have COVID, most of whom have not yet been vaccinated. But it also means an impact on others in our community who aren't able to get the surgeries they need, who have to wait longer to get the services they need. Sadly, choices not to get vaccinated is affecting our families and our communities across the province. Our healthcare workers deserve better, and so do we, all of us in British Columbia. It is our shared responsibility to get through this next phase of the pandemic, and the best way that we can reduce our risks individually as a person and to those we are closest to and to our community, and to improve the safety of everybody and get back to the things that we need to do is to get vaccinated. We need to have as many people as possible with as maximum protection as possible so we can get as much open as possible and get back to doing the things that we need and love. And that's one of the tools that we have is the vaccine card to help us do that. I want to remind everybody that this is a chance for us to continue to get through this storm together and to recognize that we all have our own experience of this past journey and that we need to respect that and we need to continue to support each other. We need to continue to be kind to each other, to be calm, and to still do those things that keep us safe. Thank you.
Thank you very much, Dr. Henry. And I just wanted to bring a few updates on questions that I know members of the media will have. both with respect to the vaccine card and with respect to surgeries in the operation of the healthcare system as of today. I want to first of all say, express my appreciation to now the more than 2.1 million British Columbians who have registered for their card. That was as of 10:30 this morning. It's in fact been a very busy 24 hours, and that number is significantly higher today, and we'll be providing more information on that before the end of today. But 2,110,000 people have downloaded the BC vaccine card in in the 6 days since we've announced it, which I think is an exceptional and extraordinary thing. Secondly, I want to say today almost 4 million British Columbians have now received their first dose immunization against COVID-19. That's 85.8% of people in BC. That's one of the highest levels in the world. 78.4% are fully vaccinated, meaning they've received 2 doses of a COVID-19 vaccine. And that number, of course, continues to climb as well. I want to acknowledge young people who continue to lead the way in that regard. Those 18 to 24 are now vaccinated at an 87% level, above the provincial average, and that number continues to go up every day. That group of people leads in registrations and new vaccination, and has done virtually every day for the last few weeks. And thirdly, that we're obviously focused very much also on the 12 to 17-year-old group, including with immunization clinics in schools around BC this week to raise the level of immunization in those groups, which is right now at the lowest level because they started last, but it's approaching and will, I think, pass 80% this week, which is a good result. I also want to acknowledge that in interior health, we've now passed the 80% level of first dose immunization against COVID-19, and in Vancouver Coastal Health, the 90% level. So people who are providing the COVID-19 vaccine around British Columbia, I think, are doing an exceptional job. I also wanted to note that as of this morning, the BC Vaccine Card Verification app has been downloaded more than 14,000 times from the Apple App Store and another 4,270 times from the Google App Store. And for those businesses who have questions and information, they can call 1-833-838-2323, support line, and press 1, then option 3 for further assistance. And we appreciate all that everyone's doing today to make the BC vaccine card a success, to allow us to do in this time, in this period of the pandemic, many of the things that we all want to do together. And the key to that, of course, and I encourage everyone to do that, is for everyone to get vaccinated. There are today, we'll be releasing the numbers around 4 o'clock today, that the numbers of cases and so on in a written statement. But there are today 139 people in critical care in BC, 139 people in critical care with COVID-19, I should say, and 121 of those are unvaccinated. Considering that comes from a very small group in the population who are unvaccinated, that is a remarkable number of people. That under the age of 50, there are 38 people in critical care with COVID-19, 37 of them are unvaccinated. And that when you consider that we have in the neighborhood of 510 base critical care beds across the province, further 218 surge beds that have been put in place around the COVID-19 pandemic, and that 431 of those base beds and 16 of those surge beds are filled around BC. The number of people that we're dealing with unvaccinated with COVID-19 unvaccinated is a very high proportion and puts significant pressure on our healthcare system. And I think the answer to that for most people is very simple, and it's twofold. First, we're going to care for everybody who's sick in BC. We are going to provide the best critical care in the world to everyone. And you see it in our critical care results. Our critical care teams, tired, sometimes frustrated, sometimes exhausted, are providing the best possible care to all of the people in critical care, particularly those with COVID-19 right now. Their efforts, their understanding, their research, their practical experience means that they're going to provide you with extraordinary, exceptional care. But all of them would rather be doing something else. And I encourage everybody to get vaccinated today. 85.8% is as good, really, as just about anywhere else in the world. It's a significant achievement for our healthcare workers and for people in BC, but we can do better. 86 is better, 87 is better, 93 is better, and so on. So let's continue our efforts to get vaccinated, thinking of our healthcare workers, thinking of one another, but also understanding that to be in critical care with COVID-19, and Dr. Henry and I have spoken this weekend with many people in healthcare who are struggling, who've contacted me and who've talked about how ill people can be. This is something at all costs, I think, to be avoided. And in this case, the cost is a free vaccine. And I recommend everyone get vaccinated. I have in prior briefings provided regular updates on surgeries in British Columbia, and as we have regular updates, and we will next Tuesday, I'll continue to provide those updates. Last week, from this podium, I announced the postponements of some surgeries in Interior, Fraser, and Vancouver Coastal Health. These surgeries were postponed because of increasing pressure in our hospitals and on our healthcare workers, largely, as I noted, as a result of individuals requiring care for COVID-19, the vast majority of whom are unvaccinated. Those postponements, I think, could have been prevented. They could have been prevented by people getting vaccinated, and we've made that case. But we want, again, people to understand how seriously and how hard the people in critical care are working to support people in those circumstances. There's no judgment in the hospital, only care. And that's why I think our staff deserves so much credit. People are obviously anxious, especially those waiting for surgery, anxious about the issue of surgery postponements. And so I want to report in detail on that. From September 5th to September 11th, the three health authorities I mentioned at the beginning, Interior Health, Fraser Health, and Vancouver Coastal Health, postponed 289 surgeries. That's 176 in Interior Health in that week, 50 in Fraser Health, 63 in Vancouver Coastal Health. There was no surgical postponements that week in Northern Ireland or PHSA. In launching surgical renewal, as you know, in May 2020, we said our targets and timelines were vulnerable to external factors like a resurgence or further waves. Further targeted postponements during the second and third waves of the pandemic last winter and spring made this clear. And the days do present challenges ahead. But I want to also note the reasons for optimism. Right? The first is that we have been through this before. We had significant cancellations before, and we have responded. As of July 22nd, for example, when we did our last comprehensive report that's available online, we delivered surgeries to 98.7% of the 14,925 patients who had their surgeries postponed during the first wave. And just as significant, 80% of the surgeries postponed over the second and third waves have been completed already. And I want to also note that we're completing more surgeries overall, that between June 26, 2020 and July 22, 2021, we completed 375,048 surgeries. We are completing more scheduled surgeries. We completed 293,716 scheduled surgeries. That's a 13,514 increase in the number of surgeries compared to the time frame prior to COVID-19. Considering all the challenges of the pandemic, that's an extraordinary achievement by healthcare workers in BC. We're adding operating room time. So those who've had their surgeries postponed should understand that we are adding operating time, and we have done, to address that backlog and to reduce our overall wait lists. Through 84 capacity increasing initiatives across all health authorities, we ran 652,983 hours of operating room time in that period. That's 29,000 hours more than in the same time frame in 2019-20. And we're also increasing staff. Since April 1st, 2020, 1,981 healthcare providers have been hired to support surgical renewal. 500 surgical specialty nurses have started their training, and 385 have completed their programs. All of this, of course, is good news, but the challenge is in the immediate moment. And I understand, because this weekend I talked to some people who had their surgeries delayed, and it is stressful. We talk about elective surgeries, but there is nothing elective about surgeries. They are scheduled surgeries, is the proper step. And when a surgery is canceled, it is unbelievably stressful for the people involved, for their families, for their loved ones. And we want to do as little of that as possible. And when we're back to being in full gear, we want to complete those surgeries as soon as possible. And we need your help. We need people in British Columbia who have not been vaccinated to get vaccinated. We need to reduce the number of people with COVID-19 in our hospitals, and we can do that. There's a tried and true, practical, demonstrated way to do that, and that is to get vaccinated. We can do this together. Last year, we took an enormous challenge, which is dealing with a backlog in surgery, and we left the wait list smaller than it was when we started. And we did more surgeries in the past year than we did in the year before that, which is, I think, a great achievement. We can do this in BC, but we need your help. And so I encourage everybody out there to do what I think is required in this pandemic, which is to join the 85.8% of British Columbians who received their first dose immunization, the 78.4% of British Columbians who got their second dose, their full dose, and get vaccinated today. We're happy to take your questions.
Thank you. A reminder to media on the line that you may now press *1 to enter the queue. You'll be limited to one question and one follow-up today. Please also remember to take your phone off mute, as you will not be audible until your name is called. Our first question today comes from Richard Zussman with Global News. Richard, please go ahead.
There were some restaurants and bars and other facilities using the vaccination card who were receiving threats from members of the public. There were threats around ordering excessive food to try to hurt the restaurants financially. There's threats of harm against those who are working. What do you say to those people who are enduring the threats? What do you say to those who are putting forward the threats? And what additional support may come from the province to help in this situation?
You know, I think I said this last week, and I'll say it again. You know, this is not an option for these businesses. These are the businesses that have suffered the most through this pandemic, and the people who work there are deserving of respect, and they're deserving of our care and following the rules. These are the rules that we have put on. They have no choice in this, and I think it really stuns and saddens me to think that people would find that an acceptable way to express their frustrations over something as important as trying to keep people employed, trying to keep businesses open, trying to keep people safe. And there are other ways that you can access and support your local businesses, whether that's if you make the decision not to be vaccinated, then do takeaway. But don't take it out on the businesses. Take it out on the virus. The virus is what is causing us to have these things in place. And yes, there are many people who are frustrated and angry, but taking it out on businesses, taking it out on healthcare workers is just wrong and unnecessary. And I know that there's supports for businesses, but really, I think what my call is to all of us who have been immunized to understand how important this is to keep these people employed, to keep these businesses open, to go out there and proudly show your vaccine card and support your local restaurant, support your local gym, support your sports team, your arts organization. You know, these are the things that we can do to show that this is part of who we are in BC to get us through this pandemic. And I don't know if you want to talk about business supports.
Well, just to say, you know, very simply, Richard, yes, what I have to say to people. I mean, I don't know what we say to people or how it is in any way acceptable to anyone as conduct to threaten people for following the law. It's really despicable. Some of these suggestions, we've heard about them, and I think they're, frankly, a very, very, very small group of people, even amongst those people who have chosen not yet to be vaccinated, the 14.2% of people in this province. I think the vast majority of them would be, as I am, appalled and disgusted by that behavior. And it's unacceptable. As Dr. Henry has said, this is a provincial health order. It's the law, and it's the law for a very good reason. On March 29th, for example, we adopted what was called the circuit breaker at the time, which was to not allow in-restaurant dining for anybody. And that was in place, as people will know, for a couple of months, and it had significant consequences, and there were for lots of people. And it had come after a period of similar measures. And from November and December, there were significant measures about gathering. We went through hockey seasons unlike any other in the WHL and in the NHL here in BC, and many other businesses, arts organizations. Everyone struggled. And what these measures are is they're enabling. They provide people with the opportunity to gather again safely, provided that they're vaccinated. That's what the BC vaccine card does. It allows for activity to take place. And that's really its purpose. I think it's going to bring about very positive change. And I just say to everybody that lousy behavior is lousy behavior. And it's not opposition to the government to threaten a local business in this way. It's despicable.
Richard, do you have a follow-up?
Yes, I'm just wondering about the repercussions for those who are not immunized in the healthcare sector post-October 26th. Is it reassignment or dismissal? How does that work? And just briefly to follow up on the first part, restaurants are trying to get used to this vaccine card. Many of them don't have the tools needed to do the scanning. Will there be supports provided for them to help scan the QR codes, or do you expect them just to continue to do visual checks?
Yeah, so to the second question, the scanning is very simple because it's not an app that downloads any information. So yes, we have supports, and there's a number they can call. There's a website. We'll be updating best practices and how to do these things. And we've had a number of calls over the last week with different sectors to help support them in this. But visual is just as good because that's the beauty, I think, of the simplicity of this card. In terms of healthcare workers, yes, it's going to be a condition of employment. So obviously, if there are medical reasons, if there are strongly held belief, religious reasons, these will be, there'll be a central process to review these, and there'll be opportunities for accommodation. And in some cases, that may mean people being reassigned. It may mean that people being assigned to separate areas, having to take additional measures, like being tested on a regular basis. But the ultimate end for people who choose not to be immunized, who work in healthcare, is a leave without pay.
Our next question is from Shannon Patterson, CTV. Shannon, please go ahead.
Oh, hi there. Sort of similar to Richard's question, how many total workers are we talking about for this new healthcare sector vaccination mandate? And do you have any concerns that you talked about some being let go if they, don't comply, but that you may see people quit, and then the healthcare sector could be short-staffed because people just won't accept it and they'll quit their job?
So I don't have numbers for you, actually, but what we're talking about is everybody who works or works for the health authorities or in a contracted organization, and it's across the board. So where it doesn't apply is probably easiest to say it doesn't apply as a condition of employment for people who don't have privileges at any health authority facilities or work at any health authority facilities. So if you're a private practitioner, a physiotherapist, or a physician who works in the community and doesn't have any privileges or work in a healthcare setting, then it would not apply to you because there's not that employer relationship. But yes, the things that we need to take into account, there are very few people who cannot be immunized with these vaccines for medical reasons, and those are things that we will be paying attention to, obviously. And we will be looking at the necessary things to accommodate people. But we also know that having healthcare workers get sick is very disruptive and causes shortages. We've seen that in places across the province right now. And that is much more likely in unvaccinated healthcare workers. And there are settings like long-term care, like many of our settings, like cancer agency, where we have immune-compromised people who are much more susceptible and cannot mount a strong immune response themselves. So there are settings where we cannot afford to have unvaccinated healthcare workers working. I will say as well that the numbers, the percentage of vaccinated healthcare workers is very, very high. You know, Doctors of BC, it's in the high 90s, 96, 97% of physicians across the province who are immunized. It's in the high 80s to 90s for nurses. So there are pockets, small pockets of people who are not yet vaccinated. And this is an important part of our responsibility as healthcare workers. One, to keep ourselves well, to make sure that we're able to care for people, especially through stressful times like this, but also to ensure that we're not infecting our colleagues or potentially bringing it into a setting where the vulnerable people we care for may be affected. We know how disruptive outbreaks are in acute care, in long-term care, and we know how damaging they can be. There is a shortage of healthcare workers across this country, so yes, I know it's going to be one added stress, but I also know that there's very, very strong support from our professional organizations, from healthcare workers across this province to ensure that they and their colleagues are vaccinated to best protect each other, but also to make sure that we can continue to deliver care.
Shannon, do you have a follow-up?
Yeah, on the third doses, there are other countries, especially the United States, actually going to be offering third doses to everybody. I know we're not there in Canada, but could you foresee seniors in long-term care perhaps being next in line for a third dose, or say anyone in our community over the age of 75? Because it seems like vaccinated people who end up in hospital with serious cases tend to be older.
That's absolutely right. It is, if you get breakthrough, and the small percentage that do in older people, yes, they're more likely to have more severe illness and end up in hospital, as we know. So there's a couple of things we're looking at. So this is the third dose as part of the primary series for people who just don't respond as well to vaccines. And we know that the studies show that people who don't have, with severe immune compromising conditions, the ones we're talking about right now, as many as 40% to 50% don't have any response, don't mount any detectable antibodies after 2 doses. And about half of them, as many as 55% of those people who didn't respond after 2 doses, will have a response after 3 doses. So that's good, but it still means there's a proportion of severely immune compromised people who don't get protection from the vaccine. So this is a completion of the series for those very high-risk people. For most of us who do mount a good immune response, we tend to see that fading over time. And so one of the things that we're doing to monitor that is what we call vaccine effectiveness studies. And the BC CDC, under the leadership of Dr. Skowronski, has been ongoing measuring the vaccine effectiveness. And we just had an update this morning, and those data will be coming publicly very soon. But it looks like we're still maintaining a very strong response. One of the things that is different here in Canada than in the United States, in Israel, is that we very early on extended the interval between dose 1 and dose 2. So there's a couple of reasons, as you well know, that we did that. One was getting that higher level of protection in more people more quickly. But the other one is because we suspected and knew from basic immunology and other vaccine programs that it was likely to give a stronger and longer lasting response. And we're starting to see the evidence of that. So right now, we're not seeing the need for a booster dose for most people, even seniors, community dwelling seniors. Where, as you mentioned, the area that we are paying close attention to is seniors in long-term care, because of the risk of those settings where so many vulnerable people are together, and what we're seeing when vaccine gets in, even in people who have 2 doses of vaccine, it can still spread. So that is the next group of people that we're looking at the data, and we'll have more to say about that. The National Advisory Committee met last week and is meeting again this week to look at data around particularly seniors and residents of long-term care. So I suspect that that will be the next group that we'll be looking at. And as I mentioned, what I'm hopeful, given the intervals that we've used here in BC, that it will hopefully align with our immunization program for influenza, and we can protect our seniors and elder in care from both COVID and influenza sometime in October. But
Alright.
that's my speculation at the moment. We'll see what the data comes out with in the next couple of weeks.
Our next question is from Justine Hunter with the Globe and Mail. Please go ahead.
Thank you. Dr. Henry, you said there are small pockets of unvaccinated healthcare workers in BC. I'm wondering if you could be more specific. I know employers were asked to provide some data to your office over the last few weeks. So can you walk us through how many or what percentage of healthcare workers are unvaccinated and explain how that has shaped the policy that's been announced here today?
Yeah, I wish I could. I can't at the moment yet. We've had some challenges in getting that information in. All of it has come in over the weekend, so it's still being analyzed. And what that is on a facility by facility basis. Every individual who works in long-term care is being accounted for so that we can understand which facilities have lower immunization rates and help us understand which ones are more at risk of having outbreaks. I know there, and I can't. I know there are some facilities in the north. There's a couple in the Fraser region, but I don't have those data at my fingertips right now. We can put that together as we get more information in the coming days. But that takes care of the long-term care and assisted living facilities. We don't have that individual level data on all workers in acute care and community care. So we're looking at how we get that information in a different way through a number of different databases. So I don't have the details on that yet. I don't know if you want to speak to that.
Just say, Justine, roughly speaking, if you look at long-term care and assisted living, we're talking about 49,000 people. This is the category of people who on October 12th were required to be immunized. In response to the earlier question, I'm trying to remember who it was. We'll get the full numbers across health authorities. Remember that the Fraser Health Authority is the second largest employer in the province, roughly 30,000 employees. Not all of those will have this applied to them, but a very significant number of them. So these involve a large number of people. And once we have the information, we'll be providing the sharing of information probably at next week's briefing to talk about where we stand and the progress we have to make between now and October 12th to get the maximum number of people immunized in long-term care. Overall, a lot of people have been immunized in long-term care, a very large majority of people. But when you go down facility by facility, there are some that are less than we'd like, and we're making significant efforts in every single one of them to raise immunization rates now, and in order to give everyone an opportunity to meet that test on October the 12th. But what we're talking about are measures that are affecting across the province, certainly more than 100,000 people in total, these two sets of measures, and that's a lot of people who are required to be immunized. And I just want to say finally about those people that this is a group of people that's done exceptional and extraordinary things for them, and this will be one more of them, one more of those things to ensure that everyone is immunized. And it's a challenge, but it's one that we simply have to meet in these times. Since we announced our decision to increase hiring in long-term care, and in August and September of 5,000 positions have been added, which is a significant effort as well to try and support the sector. But it is, of course, a concern, and that's why we want the maximum number of people to get vaccinated and make sure everyone has every opportunity to get vaccinated prior to October the 12th.
Justine, do you have a follow-up?
I do, thanks. Then I guess I'm still wondering what it is that's driving the policy change today. So we knew about long-term care, and it was pretty clear what some of the concerns were there. So what is driving the change and the need to add healthcare workers, and what kind of response are you expecting from the healthcare unions that have in the past fought very hard against mandatory vaccines when it's related to the flu shot?
Yeah, so I think that it was always our intention to support all healthcare workers being immunized, and we've been in ongoing negotiations with unions through the Health Employers Association of BC, but also working with the colleges and the associations that support healthcare workers. And you know, the Canadian Medical Association, the Canadian Nurses Association, and other organizations here in BC have also come out with support for the importance of protecting healthcare workers so that we are able to fulfill our jobs, but also to ensure that we're doing the best that we can for the population we care for. So there's a lot of support for this, recognizing the impact that this virus is having on us individually, but also on our healthcare system. So it is something that has been in the works for some time. I did want to make it very clear today because there is some talk, we started with long-term care recognizing it was the highest risk setting, and there's some concerns that healthcare workers in long-term care would leave long-term care and move to other parts of the healthcare sector where they would not necessarily need to be immunized, and I wanted to make it very clear that that's not something that we would that is going to be able to do, because the risks are similar in many settings across the healthcare spectrum. So it is something that we've been negotiating and working through. So I just wanted to make it very clear before we get to October 12th that that's not an option for people who are trying to avoid being immunized.
Our next question is from Lisa Euston with News 1130. Lisa, please go ahead.
I'm just wondering if you can ballpark, and perhaps this is Minister Dix, how many people this is going to affect by October 26th. You mentioned the 30,000 in Fraser Health. Is it around 50,000, 60,000 people overall in the province?
No, it's more than that. We're 120,000 healthcare workers, I think it is, approximately.
And we'll provide an estimate.
We can provide you with that, but just let me, I mean, the rates of immunization in healthcare workers across the board are higher than the provincial average. When we're talking about nurses or physicians or care aides, the different union groups. So this is not going to adversely affect a large proportion of healthcare workers.
That's right, Lisa, and we'll get you some more exact numbers. It's not, there will be some people who are health authority employees, people who say work in an accounting job or something like that, who this would not necessarily apply to. But overall, it's going to apply to sort of patient-facing staff across health authorities, and we'll give you an estimate on that. But it's a significant number. It's certainly overall, if you count long-term care and assisted living, certainly north of 100,000 people. So that's a lot of people working in healthcare in BC. And what you see, and part of the reason why the long-term care and assisted living thing would naturally move to acute care as well, is there's a significant number of people in acute care who are effectively either waiting for a long-term care bed or what are called alternate level of care patients, who are effectively long-term care patients. And we've seen in the course of the pandemic, in some places at some time, this group of patients has been particularly affected in acute care by COVID-19. So the need to do it across sectors, the need to ensure that facilities that are essentially doing the same thing across sectors have the same application of a vaccine requirement is why we're doing this. And we'll try and get you by your people's deadlines, which I know are now 24/7. We'll try and get you as soon as possible just an estimate of the kind of numbers we're talking about to provide precision on that. But it's a significant number, and certainly north of 100,000 people.
Lisa, do you have a follow-up?
I do, and I'm going to double end this one if I can. I'm wondering if you will ever look at doing this for teachers. I know PEI is looking at doing this, and I'm wondering if you changing or easing up a little bit in the interior with the additional restrictions that were there, if the measures that have been taken are sort of showing the province is turning the corner as far as transmissions, and it is working to mitigate, or the measures are working to mitigate transmission.
Yeah, so a couple of things. I've talked about this before, about mandates being proportional to risk in the setting. And we know that the highest risk settings in terms of transmitting COVID-19 are healthcare settings, particularly long-term care. We also know that it can be transmitted rapidly in some of the communal living settings that we have, and we've seen that with some farms, with temporary farm workers in group accommodations. We've seen it in some of the industrial camps. So it becomes much more important to have all of the workers in those situations vaccinated, and that's where a mandate for vaccination of workers to work in those settings becomes really important, not just from a business perspective, so that you can keep the business working in the whether it's a farm or industrial setting, and so, but those are employer relationships. In terms of schools, we have other things that are in place to mitigate spread of COVID-19. We prioritized all of the staff in school settings to get immunized, but making it a condition of employment is something that needs to be thought through in terms of the risk in the setting of spreading it if there's somebody who's not vaccinated, and the mitigation of those factors. So it is really proportional to the impact that it can have on the setting.
Our next question comes from Delana Nisha with CFJC. Please go ahead.
Hi, Dr. Henry. Thanks for taking my question today. I just wanted to get some clarification. So with this proof of vaccination requirements that have kicked in today, are fans now allowed at Western Hockey League games in Kamloops and Kelowna within the Interior Health region?
Right, sorry, and I didn't answer the last question about the orders in Interior Health. And the short answer is yes, the vaccine card now means that there's that layer of protection around the events. So the restrictions that Interior Health put on to some of the organized events and some businesses like restaurants, there was some restrictions, and some of the sports events, etc. Yes, they can now, with proof of the fully vaccinated, using the card, stepping up. So for most places, it's you don't have to be fully vaccinated until October. In Interior Health, given the level of transmission that is still occurring in many communities, what they're going to do is make exceptions to the restrictions that are in place to allow the capacity limits for events, and yes, the Western Hockey League is one of them, to go back to align with the step 3 that we have in the province, so the 50% capacity, but for those events or businesses that are using the vaccine card. So the vaccine card is a way of mitigating the risk in those settings by ensuring that people who are fully vaccinated attend. So it'll be things like high intensity fitness can reopen, making sure that the people who are participating are fully vaccinated. So it is one of the tools that allows us to lift some of the more strict restrictions that we have had to have in place. And it does mean that we are seeing a leveling off, particularly in the central Okanagan. So this allows us to take off some of those restrictions that were most onerous in the central Okanagan by using the vaccine card to mitigate some of the risks. So I think that's good news. We are still seeing a leveling, but unfortunately we're still seeing a increased number of people in hospitals still. So the strain on the hospital side, which starts later and takes longer, is still there right now.
Delana, do you have a follow-up?
I did, yes, thank you. I don't know if Dr. Henry would be the one to answer this or if Minister Dix would be. Wondering what immediate short-term solutions are available or currently in place to address staffing strain in Kamloops and to assist our healthcare workers at Royal Inland Hospital.
Yeah, thank you, and thanks for the question. I think that our teams at Royal Inland Hospital, like in a lot of hospitals across BC, are facing real challenges. Today's hospital occupancy is 117% in Kamloops, which is obviously not desirable. It's a significant pressure on the hospital. Everyone will know, as of Saturday, I don't have today's statistics, as of Saturday, there are 32 people with diagnosed with COVID-19 at the hospital, which is a very significant number, obviously, and a significant subset of that, I believe 13 at that time, was in critical care on Saturday. So those are significant challenges facing the hospital. Some of these issues aren't new. Earlier this year, far before this, we put in place a significant number of measures. We invested more than $1 million in new funding to the emergency department staffing this year, and 2 new full-time nurses are completing orientation this week. Since June 5th, 9 new staff have joined the emergency department, including 5 permanent full-time. We're also making significant steps right now, working with other groups throughout with all the players and all the people who are involved around Royal Inland Hospital. It's a significant challenge, but we've taken a series of measures this week to support with agency nursing, to support the management of the hospital with new staff to provide support for that. Our IHA president has taken a significant role in that, Susan Brown, as you will know, and that involves all the things you would do, enhanced support for discharge planning, because one of the key challenges in the emergency room when the hospital is full is you can't, it's much more difficult to move people up to the wards when the wards are full. So we're doing that review of long-stay patients, discharging where possible to long-term care, early discharge of patients who we can provide services at home. Obviously, the steps we've taken that I described earlier with respect to the postponement of non-urgent scheduled surgeries, that we've added, supports both at the physician level and the staff level, and of course we're continuing to do all the centralized recruitment we're doing in Kamloops. Kamloops is an important priority, and everybody knows this. One of the real challenges facing the hospital is this is a huge year for Royal Inland Hospital. You know, we're moving to the new tower next year, and so a significant work is being done on that, and what we've tried to do is take that work and provide that work over to someone new in order to, on the management side, to support the team. In short, actions in the short term, actions taken before the pandemic, support for our workers, and still there are challenges. We've heard a lot of stories about it. There are about 1,037 nurses that support activities at Royal Inland Hospital. And in the month of August, exactly 13 nurses left the hospital who were in that, and there's a regular movement when you have that many people working, of which 10 took other positions in interior health and 3 left the health authorities and effectively resigned or left and are doing something else or retired. So I think our teams have, under very challenging circumstances, are doing very strong work, and in all of those areas, all of those actions, we're giving the priority to Royal Inland Hospital that it deserves. It's an important hospital, and I think what we have to do in the midterm, we've built the new hospital. We're adding services and support services to Kamloops. We put our first urgent and primary care center in Kamloops. We've added surgeries, we've added support, we've increased hours for diagnostic services, and all these things, they'll represent challenges. It's an important hospital, and over the last number of decades, as you know, the hospitals around Kamloops, who serve other areas, have seen, while Royal Inland has got bigger, have seen reductions in services. That tends to flow demand towards Kamloops. So these are longer-term responses that we've put in place. But you know, it is a very challenging position. 117% is a lot, and there's real stresses on our nurses and our doctors and our health science professionals and our healthcare workers. And I want to encourage people, everyone in Kamloops, to respond to this, because a portion of it is to do with COVID-19, that's for sure, is that it's really important that people get vaccinated. We know that number is about 83% across the 2 community health service areas that serve Kamloops, but it can always be higher. And at a time when there's such a high rate of illness amongst unvaccinated people, it's really important that we continue that efforts to do it. There's something in our hands to be able to continue to do that, and I encourage everyone as well to get vaccinated and to support the really courageous and extraordinary work being done by healthcare workers in Kamloops.
We have time for one more question today, and that will be from Janelle Hamilton with CBC. Janelle, please go ahead.
Hi, good afternoon. On the matter of third shots, will people with developmental disabilities also be eligible for that third shot as well? Why or why not?
Yeah, so most people with developmental disabilities don't have immune suppressing conditions. So it means that their immune system responds as well as others, as well as people without developmental disabilities, to the two shots. So they are most likely, unless they also have an immune compromising condition, most people with disabilities, people with heart disease, people with diabetes, all of those other groups that are in part of our clinically extremely vulnerable group, they're there because their condition makes them more at risk of having severe illness with COVID. But they also still respond well to the vaccine. So right now, we don't think that group of people needs to have a third dose to complete their primary series, which is what we're seeing right now with the immune compromised people. But we also, as we prioritize people with developmental disabilities to receive their first series, if we need a booster dose, they will be prioritized for a booster dose as well.
Janelle, do you have a follow-up?
I do, thank you. You mentioned removing restrictions in the interior health region. Can you specifically provide some details as to when that will actually be taking place, and what will the first change be? Specifically, I'm thinking about the 10 p.m. restriction on alcohol sales.
So that it will be lifted today. I know Interior Health is putting out the details probably right now. Yes, that is something that will be lifted. I know that, so all of the revisions to the orders in Interior Health to align with the BC vaccine card and the provincial orders are happening today.
And that's all the time we have for today. Thank you everyone for joining.